Welcome back, everyone, to this week's IHRSA Take 5. As we all know, the crisis continues with a new round of possible closures or restrictions looming. There are 3,141 counties in the U.S. In addition to varying restrictions being mandated for closed by state, there's also deviations by county within the state. So it's hard to determine sometimes who to even plead your case to, because decisions are being made locally for the most part. Some clubs are holding up well so far in many states as potential reclosures are considered. States like Vermont, Maryland, Illinois, Colorado, among others, so far are remaining open. New Mexico, Washington State, Oregon, Toronto, and Ontario, unfortunately, are not faring as well as closures have already been mandated there. In addition, we know that a collection of Northeastern governors met recently to discuss and compare potential restrictions and response to the spike in COVID in their areas. So we're fully expecting additional mandates will come out this week in some of those Northeastern states. At IHRSA, we're encouraging everyone to contact their elected officials and encourage them to please just follow the facts. The research, science, data, and contact tracing confirm that clubs are simply not the source of the problem. IHRSA has the contacts who to reach out to, the tools, sample letters, of course, research, other resources, and presentation materials to help you plead your case locally, which is where we found most of the decisions are actually being made. On another note, the announcement and pending availability early next year of a COVID vaccine, which was highly publicized, I believe back on the 9th of this past week, has had a telling impact on the stock market if you didn't see it. Peloton stock dropped by 14.5%, and Planet stock improved by 10.5%. As the saying goes, follow the money. Let's hope that's the case as investors look favorably on the strong return of bricks and mortar facilities as they look out into the future and the economic impact. On an international level this past week, IHRSA is thrilled to announce the inaugural meeting of the Global Health and Fitness Alliance, including over 40 representatives from around the world. This group includes progressive thought leaders and is collaborating to build a united alliance of health and fitness community partners to serve countries, again, worldwide. We're really excited about that. The Global Wellness Institute actually released its major research report for 2020 this past week, titled Defining the Mental Wellness Economy. In the in-depth report, you'll find the global wellness economy is worth $120.8 billion and has become sort of a new industry darling, a new industry opportunity that's growing exponentially. On the research front, based on data from major processing payment firms, 15% of fitness clubs and studios have already closed permanently as of September 30th. Additional closures are imminent by the end of the year as club operators grapple with the disproportionate impact of the pandemic. Thanks to the payment processors, Rick Caro, and the IHRSA team for pulling this data together, which also include the fact that more than $15 billion in revenue has already been lost, along with, unfortunately, the economic activity that brick and mortar facilities contribute to their local communities. According to a recent ClubIntel study, U.S. fitness centers still in business are projecting a 37% decline in revenue this year relative to 2019. Of course, this information, although current, predates this most recent restrictions and closures that were ongoing right now. The Rex Roundtable Insider information this week is about the percentage of freezes same month year over year, and the average they're reporting is 19.5%. But just as a reminder for all of you, the statistics that we're sharing, especially when they're averages across the United States, vary widely depending on your geography. Some clubs have been open for months, and others, such as in California, have not been open at all. So your actual location in the country dictates results to a really large extent. So just keep that in mind as you're comparing the numbers we're sharing. McKinsey recently reported that in the U.S., the intention to engage in fitness activity post-shutdown is 65%. That trails pretty closely with what we're finding in the industry, perhaps a little higher in the industry. They're also reporting that the use of studios and boutiques decreased to 17% versus 20% pre-lockdown. So I just want to end today's session confirming what we all know, which is that these are just so challenging and frustrating times that we're in. It's just really ridiculous about how decisions are being made about whether to close or open facilities, about some of the restriction plans that are in place. Again, we just really are trying to reach out to as many elected officials as we can, present them with the facts, and encourage them to follow the science that shows undeniably that health clubs really just are not the problem. What we can do is choose to be resilient, try to maintain a positive attitude, and we hope that we can do that along with you. Thanks for coming this week. See you next week. And thank you to Precor for sponsoring this week's Take 5.